I have to think about it.
And the other thing is this.
Starting from a plank position, bend your elbows until your chest reaches the ground, and then push yourself back up. Do 25.
Because push ups work a lot of your upper body, they are a great and efficient training exercise. They work your triceps, which is this muscle here, which have an origin at the scapula, which is basically your shoulder blade, and the head of the humerus, which is the top of the bone in your upper arm. And they insert down at the olecranon of the ulna, which basically is the tip of your elbow. And they allow you to extend your arm, so from here to here. Push-ups also work your pectoralis major, which is basically your chest muscle. And it starts at the clavicle, which is this bone here, and the sternum, which is the bone that goes down your chest. And they insert at the front of your humerus, or anterior side of your humerus, so out here. And they allow you to bring your arms down to the side, so from here down to here. The antagonist of the pectoralis major is the deltoid, which is also worked in a push-up. The deltoid has an origin on the clavicle, which again is this bone here, and the acromion process of the scapula, which is the very tip out here. And it inserts on the lateral side of the humerus, so out here. And it allows you to lift your arms up to the side, so this motion, from here to here. Lastly, the push-up works the pectoralis minor, which is below the pectoralis major. It has an origin on the coracoid process of the scapula, which basically sticks out in front here, and it inserts down on ribs 3 to 5, so around here, and it allows you to roll your shoulders forward in a motion sort of like this.
Place your body under a bar. With an underhand grip, pull yourself up to the bar. Start with your arm extended and keep the body straight and core engaged as you pull. Do 2 sets of 10 reps.
In a modified pull-up, you use 3 different muscles: your biceps, your latissimus dorsi, and your flexor group. For the biceps, the origin is at the anterior of the scapula, which is over here, like inside here, and the insertion point is your radius, which is right here. So this muscle is your bicep, and its action is to flex the elbow. So you see that in a pull-up when you are flexing the elbow. The second muscle you use is to flex the fingers and the wrist. So you see that in a pull-up when you're flexing your fingers and your wrist when you're pulling yourself up. The third muscle you use is your latissimus dorsi, and it's your lower back, and it goes from your thoracic and lumbar vertebrae, which are down here, or also your coxal and your sacrum, which we know are down here and go here, and it brings it, and your insertion point is the medial humerus at the proximal end, which is all the way up here. So we know it. So it's pretty much your whole back actually. And so the action of this is abduction of the arms, and so we see this when we're pulling up because we're abducting the arms in when we're pulling ourselves up.
Bend over at the hip so that your upper body is parallel to the ground. Bend your knees slightly, and with a dumbbell in each hand, pull hands from a relaxed position up towards your chest. Do 3 sets of 10 reps.
In doing bent over rows, you engage your latissimus dorsi, deltoids, trapezius group, and biceps. Your latissimus dorsi originates at your lower vertebrae and inserts at your humerus. Your deltoids originate at your clavicle and scapula and insert at your humerus. Your trapezius group originates at your occipital bone and insert at your clavicle and scapula. Your bicep originates at your scapula and inserts at your radius. Your latissimus dorsi adducts your arm. Your deltoid abducts, flexes, and extends your arm. Your trapezius group retracts, elevates, and depresses your shoulders, and your bicep flexes your elbow.
So the next exercise is called radial deviations, and what you do is you can use a light resistance band and wrap it around your foot or something stable, and you pull on it to create resistance, and you flex and extend, flex and extend, flex and extend your wrist and your fingers. And what muscles that works out is the extensor group and the flexor group. So the extensor group is kind of like is your forearm and all the muscles that contain it, and the origin is at the lateral epicondyle of the humerus, and it inserts into your metacarpals and your phalanges. And what it does is that it basically extends, does this motion with your wrist and your fingers. And the flexor group, which is the antagonist, does the exact opposite. It's this portion right here, and the origin of the flexor group is at the medial epicondyle of the humerus, which is right here. And it also inserts to the metacarpals and the phalanges, and it does the opposite. It flexes the metacarpals and the phalanges.
Hold a basketball with both hands and stand on one leg. Flex the hip by bringing one knee up. With the leg that's off the ground, extend the hip by kicking that leg back as your core lowers to be parallel with it. Do 2 sets of 15.
So a single leg deadlift uses two main muscles, your gluteus maximus and your hamstrings. So the first muscle you use is your gluteus maximus, which has an origin at the posterior iliac spine or / the sacrum, which is like back here, and it goes all the way to your posterior femur, which would go all the way down here. And so basically this muscle extends your hip. And so you can see that when you're doing the deadlift because you're extending the hip. The second muscle you use is your hamstring, which is made up of three smaller muscles, and their action is the flexion of the knee. And they have an origin at the ischium of the coxal, which is basically where your femur attaches to your coxal bone. And then it goes all the way to your tibia. And so that's your hamstrings. And so the reason why in most deadlifts you use your quadriceps, but because these deadlifts are going laterally, you're actually using your hamstrings, so you don't actually flex your knee.
Stand with feet shoulder width apart. Hold a basketball out in front of you with your arms bent at 90 degrees. Raise your knees to hit the ball continuously and do it for 20 seconds and repeat it 4 times.
Knee highs use the quadriceps, which is this muscle here. They attach at the ilium of the coxal bone and your femur. And they have an insertion down at the patella, which is your kneecap, and the tibia, which is your shin bone. They allow you to extend your knee. So if your leg is like this, you can bring it down like this. Knee highs also use the hamstrings, which is the muscle in the back of your leg. Hamstrings have an origin at the coxal bone and the posterior femur, which is here, and they attach down at the tibia and the fibula, which are your two bones in your lower leg. They allow you to flex your knee. So if you're in a standing position, you can bring your leg up.
Start from a standing position, jump onto the box, landing in a squat while catching a basketball. Throw the ball back and jump backwards. Do 3 sets of 10.
So box jumps are basically plyometric squats, and they work out mostly all of your lower body. And the gastrocnemius, which is your calf, it plantar flexes at the beginning of the jump, and you have to lift your heels up off of the ground. And the tibialis anterior, which is the front part, it's its antagonist, and it dorsiflexes, which is this, at the end of the jump, when you have to dig your heels into the ground. And the hamstrings and the quadriceps, which are also antagonists, help you jump as well. So the hamstrings flex the knee at the beginning of the jump, and the quadriceps extend the knee right afterwards. The gluteus maximus is also activated because it extends the hip at the beginning of the movement, so like right before you go to jump. And then its antagonist, the sartorius, which is a muscle that runs diagonally across your quadriceps. It flexes the hip right before landing on the box. So
Lie on your side, hold the ball above your head, raise your leg up, keeping your body parallel to the ground. Do 3 sets of 10 reps of each leg.
Lateral leg raises work your sartorius, which is here. The origin of the sartorius is the iliac spine, which is here. And the insertion of the sartorius is the medial surface of the tibia. And the sartorius allows you to abduct your hip like this. The lateral leg raises also work your gluteus maximus, which is here. The origin of the gluteus maximus is the posterior iliac spine and scapula, which is here. The insertion of the gluteus maximus is the posterior femur, which is here. The gluteus maximus allows for the extension of the hip, which is like this.
Oh, the leg lift thing?
I need to do a workout. Okay, you gotta do that. Maybe we'll just cut it.